Good morning, everybody. It's Dr. Pearlman, and I'm a chiropractor here in Dallas, Texas. Some of you know me from my channel. It's been around for a little bit. And if you are new to the channel, welcome. So here's what we're going to do. As you can see, I am laying on my stomach. That is also called prone in the world of kinesiology and exercise science. We like to, or I like to refer to this as tummy time, not just for children, but for a lot of people who have chronic back pain, which I still do, but thankfully it is nothing compared to what it used to be. The liability of what my back pain used to be potential for how disabling it was really like inexplicable to people who have never experienced that. And I hope that none of my beloved family and friends would ever have to experience what some of that I had to go through. I did have a laminotomy foraminotomy, which is partial laminectomy, the bone around the spinal cord, usually only happens in the lumbar spine surgically. We had that partially open to make room for my spinal cord and spinal nerves. And we also did the foraminotomy, which is a fancy word for saying the hole on the side of the, or obliquely to the central part of the canal for the spinal cord to open up spinal nerve roots was also opened up with like a little Dremel-like tool. And it's been life-changing to say the least, but it certainly hasn't done anything to eliminate a lot of scar tissue and back pain. So I'm leading with this to let you know that in my experience, and experience means a lot, right? So a lot of people love to quote biased and or agenda-driven research from one party to another. It's always something that is fairly inconclusive in the sense that they want to do more research, and it's been going on like that for a while, especially in the world of back pain when it comes to non-surgical intervention or therapeutic passive therapy like chiropractic versus active therapy like exercise. So I'm here to tell you that regardless of who thinks that the research says or the evidence supports, one thing and it's clear, I can tell you it's not clear. So the only thing that is clear is that it's definitely not clear still to this day. And I believe that when people are very disabled by back pain and they have what's known as stenosis, it's okay, you can look it up, even though it's a fancy way of saying compression of the spinal cord or compression of the spinal nerve roots or both. A certain level of stenosis would probably mean that surgical intervention is inevitable. A lot of people can delay the inevitable, that's okay. It really depends on how functional or non-functional you are as to whether or not you should get that type of a surgery. And again, I'm here to tell you, 1 year removed from surgery, actually I'm coming up on my 1 year anniversary, will be 9/11 in the next few days, or in a week or whatever, that I couldn't really tell you that it was this like massive success, but I can tell you that it is definitely based on the non-disablement that comes along with back pain, that it was a huge success. So what can we do to manage our back pain? Like we all think, going to the chiropractor, maybe they'll adjust me, it's just what I needed, and yeah, a lot of times it is. But I'm going to shoot straight with you like I always do, like I always have. And one thing I kind of tell people now is like, I don't have the time and the energy anymore to try to like tell you to change your mind. There you go. I don't have the energy anymore to change anyone's mind. I'm going to continue to educate. I'm going to put the information right there in front of you. I'm going to tell you the truth as far as I know from clinical experience and, years of schooling and my personal experience also as a patient and lots of things that I have seen in the last, 15 years or so. But what I can tell you is it's never just one thing. So if you think like, oh, I bent down to pick up the dog and my back went out, or I went to pick up the baby, or as people love to always tell me that they slept wrong, it's never one thing. Like you can't have that kind of chronic pain based off of the one thing that happened recently. You could have had an injury that injured many tissues, right? So tendons, ligament, disc, spinal cord, bone, and then 10 years later, it's continued to progressively get worse and worse and worse without attention, without aggressive rehab. Because let's face it, I'm going to give you the secret right now. So if you listen through the 5 minutes of this video, here comes the secret. The secret is you need to do a passive modality chiropractic. Sorry, it's what it is. The better the chiropractor, the better the passive modality. That leads to what we call passive progressive modalities. So that means a therapist, a massage therapist, a kinesiologist, an exercise scientist, whatever, a physical therapist would probably be the most qualified, possibly chiropractors, but someone who really understands functional movement, okay? And passive therapy, like lengthening and shortening of muscles. Fascial distortion is a big thing, like talking about anatomy trains, look it up. People that understand that, they can work with you for that passive, again, the instructor or the exercise person, the therapist or the chiropractor, whatever, the doctor is the one doing like 90% of the work as they progress your body through motion. See, that beats something called fear avoidant behavior. Fear avoidant behavior is what keeps you moving through ranges of motion safely the way you want based off of like learned behavior that keeps your brain and your body scared of certain movements because they know the pain consequences. The third phase is something called active progressive motion. Oh my God, we just took that same progressive motion and now you actively are the one doing it. So you have to stabilize. That's where things like weightlifting and exercise, what they call active therapy, becomes imperative. That is why we say to exercise. That's why we say to do planks. That's why we say to do the bird dogs. That's why we say to do glute bridges. That's why we say to do side bridges. That's why we say to lift weights and deadlift and squat and all that stuff. You have to do it because if you don't, you're never going to get to the last phase, which is active, full compressive motion. How do you fix any joint in the body, as the knees over toes guy so beautifully, eloquently put it in the Joe Rogan podcast? He's so famous. Ben Patrick, love the guy to death. I think he's brilliant. And that is compression and motion. If your body cannot take compression and motion, full compression and motion in a given joint, you're never healed. So how do you get to that point? Well, I just gave it to you in the first 3 steps, and I'm not going to repeat it here. But just know that they are all just as vital, just like it's never one thing or one muscle is why you're hurt. That's why I'm just going to say something a little controversial here. If you go to the Arasti guy, or you go to the exercise science guy, or you go to the kinesiology guy, or you go to the trainer, or you go to a chiropractor, or anyone who says it's that right QL muscle, man, it's that damn right psoas, it's that damn right QL, it's that right glute not firing, it's that damn weak left hamstring, that darn adductor group has been the problem this whole time. You need to tie your shoelaces up, not too tight, I don't want to cut off circulation, but not too loose either. I don't want your shoes to come up, for you to run out of your shoes, and you need to run out of the office. Just like if you came to my office and I said, hey, let's just adjust you 30 times and that's going to fix you because that's all you need and that's what we do, you should run out of my office. If anyone tells you it's just like this one little isolated thing without making it about something that relates to multiple factors and multiple tissues that are injured and multiple neuronal patterns that are inappropriate and need that, dare I say the word rehab, then like they're just lying to you and they're full of shit. And maybe they're trying to oversimplify. I hope that's not the case, because I would never tell somebody like, hey, there's like, this one thing and it's this one thing that's the reason. Yeah, I mean, we could all look at ourselves in the mirror Goggins style and be like, the one reason is us, right? The one reason is you, That's a whole other topic of conversation. So guys, it's that simple. I'm here to keep it real. I'm here to tell you the truth. And right now, while I just decompress my back after a very long 3 weeks of a little birthday vacation, very fortunate, lots of sitting at baseball games, lots of driving, lots of in and out of the airplanes, lots of stress to deal with, some personal stuff. We had Jen's car almost got stolen. Ridiculous. I mean, this is nutty stuff we're dealing with. Like, we've all got issues, but I really wanted to get in here and just talk to you again. I guess you could call this an updated podcast, but guys, if you have any questions, just reach out, go into the comments, go to the website, Dr. Pearlman TV, all one word, Dr. Pearlman TV, one word, Dr. Pearlman TV. Just go to the website, see all the social media stuff, see all the avenues, request an appointment, request a consultation. If you just want to ask a question on social media, I'm very responsive. As long as you guys are nice, you know what I mean? I'm going to be responsive. And, that's it. Have a wonderful day. Have a wonderful week. See ya.